Yeah, welcome everybody. We're kicking off the new year with our webinar series coming back. Happy to welcome Jim Janakievski tonight to a very informative webinar on a new product that we've been using a little bit in our office the past year and getting ready to use in a clinical trial. Excited for you all to hear more about it, and I'm going to ask Jim to take it away, share his screen, and if everybody else could, if you're not, please put yourself on mute and we'll get started. Hello there, Dr. Caviani. Go for it, Jim.
All right. Okay, can you see the screen, the first slide?
Yeah, I'm going to try to hide our panel here.
Okay. So I want to thank iHDS for this opportunity to talk to all of you tonight. And Todd, thank you very much for the invite and facilitating this. As Todd mentioned, it's a product that I'm involved with. I'm a co-founder of this company. I'll tell you more in a little bit. And it's a product that Todd's been using for a while, so he has some experience. Some of you on this webinar might have had some experience with it. If you're a co-investigator in the clinical trial that's going on right now, you'll be receiving this product to incorporate into your workflow. So I'm happy to talk to all of you about it. And there's things that I'll get into more in depth and things that I won't, that I'll leave kind of open so that we can discuss if there's questions at the end of the presentation. So I'm going to move forward then. Question that I guess that I'd like to answer for this presentation is, why do we need a dedicated implant screw channel barrier? Is there a problem? Do we have problems with what we have right now or what we're using right now? So this presentation will be kind of an overview, kind of on our journey of how we thought about this, how we came together, my partner, Alex and I, how we came together, what problem we wanted to resolve and why we wanted to resolve this problem. What was the issue for us? So introduce Alex Shore. Alex is my partner in this project. Alex is a prosthodontist in Seattle. The two of us met in grad school. So I was in grad perio, he was in grad pros. We graduated a few years apart, but we were teaching at the university at about the same time. So we were teaching full time and we became friends. And we shared an interest in landscape photography. So that actually brought us together, brought us closer, because we'd go on these trips and do landscape photography. So, on these trips, when you're away, if some of you are photographers, you know that the best time for landscape photography is either in the morning for sunrise or in the evening at sunset, right? And so what do you do during the rest of the time in the middle of the day? You kind of sit around, you either look at your pictures or you just kind of waste time and wait for the get ready for the evening sunset. So during that downtime, being dentists, what did we do? We sat around talking about our dental practice and challenges that we had in our dental practice. So from all those kind of conversations, we would try to come up with solutions to the problems that we were seeing. And one conversation led to another, and we eventually formed a company that we wanted to develop some products or develop some of these ideas that we were coming up with. The name of the company that we formed is called 35 Newtons. So this was obviously all of you being dentists and having experience with implants will understand this. And being kind of the most common torque that was utilized for the original implants that we used for in the early days was 35 Newton centimeters. And nobody says Newton centimeters. We all say Newtons when we say how much we're going to torque it. And we figured that everybody would understand when we named the company 35 Newtons. Our goal when we formed this company was to develop products and devices that would improve clinical practice. So our mission develop a better workflow, help clinicians develop a better workflow so that they can have a better practice. And we came up with several products. And if you're interested, we could ask me questions about it at the end. But developing a product and bringing it to market is very difficult. And we developed several products that never really made it to market. And we learned a lot from that process of everything that needs to be done to not only design it, but to manufacture it, and then to test it, and then to put it in the hands of clinicians. So our first product that we brought to market is the one I'll be talking to you about tonight. And the product is called First Plug. And this is a dedicated implant screw channel barrier. So I'll be telling you more about it in a bit. Now, how did we come around to this? Again, so what really has been happening in implant dentistry, and why was this a problem for us, and how did we come up with this idea? So everybody knows how dental implants, or when dental implants were introduced in North America. And, implants were designed at that time to be basically a retrievable prosthesis. So with intention, the design was to make a screw hole so that we can retrieve it. It was so that we can remove this prosthesis, repair it, replace it. We never really had intention to permanently place it in the mouth and never ever remove it. It wasn't even designed for partially edentulous. It was the fully edentulous patient. But, from here, we started evolving into the partially edentulous, and we still kind of continued along this retrievable design, utilizing, these abutments were designed, these UCLA type abutments, cast 2, again, giving us retrievable prosthetics. But this eventually, we started to question this, and there was kind of a movement. And some of you who are my age or older will remember that in the late 90s and early 2000s, there was, questions about why we need to continue making a retrievable prosthesis. Clinicians were saying, why do we need ugly screw holes? We don't want to deal with screw holes. And in order to maybe avoid the misangulation of implants, or implants that didn't allow for screw retention, it was proposed to simplify the process and make our restoration screw retained. So we went through this whole phase. And when I was a grad student, our directors were in favor of screw retained prostheses. And there was never really a question about why we needed to do that. You could hide the screw hole, you could correct for the implant angulation. And so this was kind of the trend for many years. And what we realized, though, over the past, say, 30 plus years now, since the original conference in Toronto, is that we've been through these phases, and we now, looking back and looking at our experience in implant dentistry, realize that it's not as straightforward as we thought it would be. We're dealing with a lot of complications, be they biological or technical, which require us to maybe remove the prosthesis and service the prosthesis. So given that, we've kind of now looked back and kind of began to redesign our prosthetics based on our experience these last few years. And so I would say that, the majority of clinicians right now maybe consider this the more modern approach, that retrievability is the preferred technique to use for prosthetics. In fact, maybe some might even say that it's required, given our knowledge and experience with retreatments and reparative treatments for different implant solutions. So we have hybrid designs, which have a component on the prosthesis that replaces the missing ridge and soft tissue. We have these screw-mentable type designs, which allow us to use these CAD/CAM fabricated abutments. We can cement a crown on there, but we still have retrievability because we have a hole through the crown. And so we're using less metal. We're using more CAD/CAM developed and produced products. And we even have these angulated screw channels, which now allow us to create a screw retained design, even if the implant angulation isn't favorable for it. with the challenges that we had before. Now we don't have those challenges anymore. So given that, now that we have ability to create more retrievable designs for our prostheses, that means we have a lot of screw holes to deal with. So today we can probably say that 99% of the cases, we're going to have a screw channel that we have to deal with. So even in a cemented design, we have a screw channel that we're going to deal with. So these screw channels, in some cases, are fairly significant, depending on where the exit angle is and the size of the screw channel based on the implant design. So we need to have a strategy for managing these screw channels. So this is where we kind of started questioning, what are we doing with regards to screw channels? Can we improve what we're doing? And is there really a problem with what we have? So we realized that we really didn't have a dedicated screw channel barrier. And I'll explain that to you a little bit more. Screw access channel management is something that wasn't really talked about so much. We just started doing things in our practice. And this is kind of like a bigger picture and a bigger discussion, but we need to talk about, how we minimize bacterial contamination in the implant abutment interface, how we manage our restorations when we install them, how we can improve our efficiency and our workflows when installing these restorations, and we want to make sure we maintain future retrievability. So what do I mean by screw access channel management? Well, the first step is basically how do we manage the restoration and the screws? So if some of you are prosthetic or restorative dentists, I would ask the question is, do you ever get a restoration back from your lab and the screw is dirty? Do you ever check it like in a gauze, like take an alcohol gauze and wipe the screw? Do you find that it's dirty? Some labs maybe spend a lot of time cleaning the restoration and the screw. Some will give you a separate screw. So they use a lab screw when they're fabricating the restoration so that when it comes to you, you have a brand new fresh screw. But others don't have that. I can tell you my experience is that many of our local labs, the restorations, even when they clean them, when they steam clean them, they still come back with debris on the restoration. So dental lab quality control is very important because that is the first step in minimizing contamination of the implant abutment interface, And then chairside cleaning protocol. I always ask the restorative dentists that I work with, what is your chairside cleaning protocol for your restoration prior to installation? Or do you just take it off the model and put it right into the mouth? And if you do that, then you have really a contaminated restoration, be it a metal or solvent contamination on these screws and or restoration. So that's really the first step. The next step is, installing the restoration and then creating or choosing the appropriate barrier material. And we'll talk more about that in just a bit. And then, of course, the access filling, do you have a sufficient depth, and then your choice of restorative material for that. So this led us to the development of this product because we felt we needed a better screw channel management protocol. And this being just one step of the screw channel management protocol, we felt that we could improve upon that with this type of product. So I'll tell you more about the qualities of this product in a bit. I want to answer these questions, why we did it, why we made this product, what is it exactly, and then how does it work? So when it comes to access fillings, just moving in a backwards direction for a second here, there's really no controversy when it comes to access fillings. We have approved dental products, which we use for filling or restoration of teeth. So we can use those approved dental products for the restoration of access channels for implant restoration. So we can use composite resin. We can, of course, use amalgam. We can use products like Telio for interim restorations. So there's not a lot of controversy when it comes to closing and finishing the closure of the access channel. But it's very different when it comes to barrier materials, because we don't have a dedicated screw channel barrier, right? These were all off-the-shelf solutions. So what did we do in the early days, and many clinicians still favor this, is we would use cotton. We just pulled the cotton pellets out of the drawer and used that as the barrier for the screw head. Now, we all know the problem with cotton. It gets saturated, absorbs moisture, it grows bacteria. And so it's a problem over the long term because of those reasons. It doesn't provide good support for the overlying restoration. So you see in a lot of those cases, you get push through of the overlying restoration or sinking in of the overlying restoration. As clinicians, we tried gutta percha for a while, but that was also a problem because you have to melt it. It's difficult to remove. It breaks apart. So it's not a good material. It's inefficient. It takes a lot of time. Silicone, it also degrades over time and it breaks up. It's harder to remove. And it also doesn't provide good support for the overlying restoration. You get a lot of push through or dislodgement. So it kind of led us to, we eventually evolved as clinicians to using what is probably the most popular screw channel, barrier right now is plumber's tape. So thread seal tape. So this is an industrial thread seal tape known as plumber's tape. And it's become the most common barrier product that we use. And the original publication on describing the technique for using this was back in 2010. And it described how this material can be prepared, how it can be installed, and how it services as a screw channel barrier. Now, this material is polytetrafluoroethylene. So we know polytetrafluoroethylene. Many of us are familiar with this if you're a surgeon. Membranes, sutures made out of PTFE. PTFE is a textile, and it can be made as a medical textile, and it's used for these various designs for dentistry. It's used in medicine to create vascular stents. And so in medicine, we have applications for PTFE. Outside of medicine, we have, everybody knows if you have a Gore-Tex ski jacket, that's also PTFE. So we understand the properties of PTFE. It allows air to go through it. It's very resistant to fluids, so very hydrophobic. So because of those reasons and those qualities of PTFE or polytetrafluoroethylene, it actually makes for a good barrier material. It's easy to place and remove if it's formulated well, and I'll talk about that with respect to first plug. It's hydrophobic, so it doesn't absorb moisture. It squeezes, you can squeeze out the moisture and blow it away. It resists chemical degradation. It can be sterilized. Polytetrafluoroethylene has a very high melting point or degradation point when it comes to heat. So it's a sterilizable product, and it can be made low cost. So what are the disadvantages of using industrial thread tape or plumber's tape? Number one, it's not a medical product. It's an industrial product. It's not standardized in its manufacturing. So if you ever researched how plumber's tape is manufactured and where it's manufactured, it's made in many different places around the world. We certainly have manufacturers here in the US, but most of the PTFE plumber's tape, and I guarantee you most of the tape that you use in your practice is the type that's manufactured either in China, Malaysia, different parts of the world that have very different manufacturing practices. Each tape is not the same. It's not manufactured the same. They're not biocompatible because they're made in industrial facilities, open air facilities, on dirty machinery. They have residual solvents and impurities in the product, which is not important for industrial use, but it becomes important when we think about it for our patients, for medical applications. The material isn't optimized in terms of its properties for packability and removability, so it's not as efficient. So where did we start off in dentistry with plumber's tape? It really started off back, I would say, in the 90s when bonding protocols were evolving. And one of the early uses of plumber's tape was to basically prevent getting etch on the adjacent teeth when you were bonding restorations in place. So from here, basically, we started, thinking about other applications of plumber's tape. And it became essentially like a de facto medical product almost. Here we use it for screw channel barriers. Its application for use in restorative dentistry, such as a twisted cord that's made chair side to push away the rubber dam and push away the gingival tissues. This is a very popular use of it now. And even like this, we're used right in a surgical site. So taking an industrial product and pushing it into a surgical wound like you see this. All these photos are taken from Instagram. Everybody wants to show what they're doing right now on Instagram. And sometimes, we as clinicians aren't really aware of some of the limitations that are present when, or that we should consider when we're using or applying an industrial product in a medical application. So which plumber's tape do you like, and how do you choose your plumber's tape? So, you walk into Home Depot and you see a big cage like you see there on the top, and you've got the two different types of plumber's tape. You go on Amazon, you've got all these different ones available to you. How much do you know about plumber's tape? And so we asked that question. We said, well, as clinicians, should we be using this? What can we understand more about plumber's tape, and is there concerns that we should have? So Alex and I delved in a little bit deeper into this. And when we started looking at literature, we started looking at publications. We even saw publications like this, which proposed, using different colored plumber's tapes to create a system to identify the screw channel. So you pop into the screw axis channel and you see it's a yellow plumber's tape, and that should indicate to you that it's an 048 hex. And so, we as clinicians have kind of started to propose all these different applications of plumber's tape, including these colored plumber's tapes. But there's very little that we understand about this when we're making these proposals. So let me tell you what we know about how plumber's tape is manufactured. And, our understanding of colored plumber's tapes goes beyond, what we feel emotionally about it, or how we want to apply it, like in the previous article, to represent certain screw channels or screw heads. When Alex and I started developing this product, we did a survey, and we surveyed many restorative dentists. And one of the questions we asked them is, do you use colored plumber's tape, and what's your preference? And it was really eye-opening to get these answers. We would get answers like, I like this color because it's my favorite color, or I like this color because I can see it better. And it was all across the board, no rhyme or reason. Now, if you have some experience with plumbing, you'll understand that different colors of plumber's tape are made for different applications. So, for example, green plumber's tape is for oxygen pipes, okay? Now, green plumber's tape is grease-free or solvent-free, or it has less solvent than every other plumber's tape. So they go to the extra step to clean it, okay? Whereas the other tapes do not. The reason for that is because they don't want any risk of combustion or a chemical reaction when it's used on these oxygen pipes. Gray plumber's tape has a pigment added to it, which is nickel, to make it gray. So, if your favorite plumber's tape is gray and you're using it on your patient that has a nickel allergy, that may be a problem. And so you look into different manufacturers and you can see kind of how much you can learn about this, and what exactly goes into developing or preparing these products for their industrial use. So you can read here on this one here, this Blue Monster product, the green product. It says it's made from a PTFE resin mixed with a small amount of solvent. For normal applications, it doesn't matter if the solvent is not removed from the finished product. That means all other tapes have a more abundant amount of residual solvent. However, when operating in an oxygen environment, remaining volatiles can react with the oxygen and cause an explosion. So they go through a rigorous process to remove the solvent. So that means others, do not. So essentially, these products aren't clean products, that we're using. And do we as clinicians, or does dentistry in general have a concern about these products? So this was our other question that we went in, that we kind of delved into when we were developing this. We said, well, does anybody have a concern about this? Does anybody else wonder about using this industrial thread tape in our patients? And so you can see this. This is from a very, this is from a large continuing education center, from their blog. And this clinician asks, you know, what do you do to prepare your plumber's tape? How do you process it? So obviously in their study clubs, you know, somebody brought this up and they had a concern about this. And so they all agreed not to write plumber's tape or Teflon tape in their charts, because if it becomes a medical or legal issue, then they don't have to really describe it or defend it. So obviously, you know, the profession has had concerns with this. And look at lately here, what is being posted on social media. So this is an Instagram post. And so this is an orthodontist who posts various reels, and he posts topics on just all kinds of information in dentistry to try to inform patients, I guess. I guess that's the purpose of it. So I'm not really 100% sure. But so how do you think patients feel about having plumber's tape put in their mouth? And so I don't think we ever asked ourselves that or asked our patients. And we learned that actually going through the process of making this product and meeting with our engineers, our designers, legal counsel, you know, all of them, when they discovered that this was the way plumber's tape was used, they were all very surprised. And so this post here was showing how this dentist is removing the plumber's tape. And obviously we see this, this is a hybrid restoration, a fixed hybrid. But many of the non-dentists who were watching this did not know what this was. And so they had all kinds of questions and comments, and you could see them here. So, you know, you can read through them yourself. I mean, you know, local honky, you know, thought that, hey, she has mozzarella coming out of her teeth, right? And, you know, Michelangelo Peabody says, is there nothing else that could be used besides Teflon? That stuff is absolutely horrible for your health. And so, you know, and then obviously somebody else here is a plumber. He says, I use Teflon at work, and it's helped threaded pipe to have to not have any leakage or seepage, right? But take a look at some of these other, you know, Teflon is poisonous. You know, Teflon causes cancer. You know, it's a DuPont's material. So there's also a lot of misunderstanding of PTFE. You see the name Teflon, and we really shouldn't use that to describe this plumber's tape, because Teflon is a proprietary name. It's owned by DuPont. So Chemours DuPont owns that, and they never made plumber's tape. So Teflon has never been legally applied to a brand of plumber's tape. What they made is a non-stick pan, you know, and there's a lot of controversy with DuPont, as you know, with some of the issues with the factory and the dumping into the water, and also some other issues that came up with some of their products. So, you know, it scares the public. And so they may have a misconception about these products. And if we start if we don't educate ourselves and we don't educate the public, we certainly can have maybe some challenges with it. The other question that we wanted to answer is, so why should we change this product? Why should we consider maybe using a medical product? So Alex and I thought, well, if we make a medical grade PTFE, is it really going to be that different, or is it that significant? So then when we started investigating the difference between a medical product and a non-medical product, it became much more clear to us as well. So you see this is, let's compare a scalpel versus an X-Acto knife, right? So if you're a surgeon, of course, you would tell me you're not going to use an X-Acto knife to make an incision in the mucosa, right? So the difference is that a scalpel is designed specifically for surgical use, right? It has features which are unique to the surgical application. The FDA mandates that these are biocompatible materials for any patient contact devices, right? And if it's sterile, or if it's supplied for you know, human or medical use, it needs to either have clean room manufacturing or some sort of a sterilization process if it's offered sterile. The manufacturer is required to follow good manufacturing practices. So this is quality control for the manufacturer. And so this includes not only from the design process, but the manufacturing, document controls, complaint handling, corrective action, et cetera, all of that. And if there's a problem and you as the end user of the product is concerned about it, the manufacturer is required to have a complaint handling process for a medical product. You compare that to a non-medical product, it's not required at all. There is no, it's not necessary to have, be packaged in a clean room or maintain a certain level of manufacturing, such as the examples I gave you with the plumber's tape, with the residual solvents and the impurities that are left on it. And the manufacturer is not required to have a quality control system in place, to manage the level of challenges and or complaints that could arise from their product, because it's not really designed to be used for medical purposes. So they have a different kind of standard. So, with that said, I would ask you then, what else is potentially a problem in dentistry that maybe where we have used a non-medical product for a dental or medical application. So have any of you used, and obviously I can't see you, but think about this yourself. Have any of you been taught either in residency or you've used in practice a paperclip as a post? So if you have, you maybe want to stop that practice, because dentists have been challenged and have been sued for actually using paperclips as a post. And so this is just one example. If you Google it, you can see several in the literature where dentists have been sued for using paperclips. So let's just very quickly listen to how the lawyers interpret this.
Tonight, Action News investigates a local dentist who says he used paper clips for root canals.
Bought at an office supply store, then permanently inserted into patients' mouths. Investigative reporter Paul Van Osdal joining us now. Paul, state regulators don't seem to have an objection with this.
Well, it's been 5 years since state officials first heard a former employee's complaint about the dentist using paper clips, but no disciplinary action has been taken against him.
I'm going to pause here, and I'm just going to go to some questions here that the legal counsel is asking.
They pointed out that posts designed for root canals cost $3 a piece, but paper clips can be bought at Staples for just 4 cents.
When you were buying paper clips from Staples to be put in the mouths of human beings, how much did they cost? Was it about that?
I don't know the answer to that, but I'm sure it was similar.
When dentists do root canals, they use these specially designed drills that match the size of the posts. Polino was also asked about that during his deposition.
At Staples, could you buy any matching drills with these paper clips?
No, but I could get.
Was the answer no?
No.
Polino said former officer.
So I'll stop it there. But you start to understand a little bit more when you look at this from the perspective of maybe the patient and or with respect to the regulations and what's expected of us as medical and dental professionals and the products we use in our practice. So what's the solution? We looked at all of these things, Alex and I, and we thought, okay, this is a problem on these various different levels. So our solution was to create this product, this screw channel barrier. It is made out of PTFE, and for the various qualities that I described that PTFE has, but we specifically formulated it for its use in a screw channel. So it's called First Plug. And, this was a campaign that we started last year. So we officially launched the company, or the product, so to speak, October 2021. And since then, we've undergone several campaigns to help spread this information to dental colleagues. And so this was one of the campaigns comparing the plumber's tape to the First Plug screw channel barrier. And the things that I want to highlight to you that we may not understand is, of course, the things that I mentioned to you already, but understanding kind of how the FDA views the use of industrial products in a medical application. So First Plug is registered, the company's registered with the FDA. It's a class 1 medical device, and we are compliant with everything that the FDA requires of a company that manufactures medical products. If you use an industrial product in the application, such as plumber's tape for a screw channel barrier, some clinicians, I've heard them in presentations say this is off-label use. That's incorrect. So off-label means you're taking something as a medical doctor or as a dentist that already is approved for use in the medical or dental field, and you're using it slightly different. So I'll give you an example. If you use bone morphogenetic proteins, we have approval for use in sockets and sinus, but if you use it in large ridge defects, a one wall type defects, or other techniques where you mix it with bone, that's off-label use. But you're allowed to do that as a clinician because you're a clinician and you make that judgment and you can adapt your product. Same like a physician that may prescribe a drug that is intended, say, for hypertension, but they prescribe it for treating another condition. So that's off-label. But when we take an industrial product and we use it in a medical application where it was never intended for, that's considered adulteration of a product. So adulteration of an industrial product. So that's how it's viewed by the FDA. The differences between these products, I think I've made clear. There's contaminants, impurities, pigments made in unregulated facilities. The manufacturing is not standardized. There's no strict quality controls. So the differences are quite obvious. So we wanted to optimize this product. We wanted to make it as good as it can be to work well and also to be efficient. So what we did is we created a PTFE with a very specific density that allows for very good packability and retrievability, but it packs really tight and firmly, and it supports the overlying restoration quite well. You see it's shaped like a cord, so it's not flat, it's not a ribbon. It's a 1.8 millimeter diameter cord. And we have specific guidelines as to how long to cut for based on the screw channel depth. So we spent a lot of time optimizing these properties, and we went through numerous different densities to find the optimal one. And if you've used it, you may agree it has a very nice feel to it. It's kind of a very elegant kind of texture to it. The delivery system, I have to give credit to our designer, Andrew Bowen of Bowen Designs. Andrew designed the container. We in conjunction with him, we kind of described what we wanted, how we wanted it to look. We want it to have a certain look and feel because design is important to us. But we also created an efficient delivery system. As you can see here, there's a ruler on the inside of the cap. This is for your assistants. Your assistants can open it, can cut the length that you require based on the screw channel depth. So that's included in the instructions for use. If you have a screw channel depth that's, say, 1 centimeter, you may use only say a 2 centimeter piece of first plug. If you have a deeper screw channel, say that's for a fixed hybrid, you may use a larger piece. And so we give those guidelines and you would cut the piece appropriately. So there isn't a lot of waste that way as well. So it has a very efficient delivery system. We have these placement and removal instruments. So if you've ever struggled placing plumber's tape and or maybe taking cotton pellets out of screw channels, you know that you need some specific instruments. So we designed these specifically for first plug, and it works quite well for the packing and for the removal. So it's a very efficient workflow. The product itself is made by a manufacturer that also makes other medical products. So make heart stents, sutures, and various other dental medical products. It's packaged in a clean room like you see here, and it's a class 1 compliant medical device. So cost, we're always concerned about cost as dentists. And so this product is $50 for the container. It has about 210 centimeters of material. That's enough for about 50 average size crowns, so 50 applications. So it can cost you anywhere from say 50 cents to $1 per crown. Given that the average implant and restoration costs around $5,000 in the United States, it's not too much to ask for to put in a dollar's worth of barrier material. So, but when we were, again, looking at costs of products in our practice, we wanted to be able to compare them. So we can say to dentists, look what else costs you about $1 per use. So if you do analog impressions with PVS material to put the adhesive on your tray, you can see that that bottle of adhesive has a certain number of applications. Each application costs about $1 per tray, okay? Rubber dam, mixing tips, Softlex disc can cost anywhere from 80 cents to $1, depending on where you buy them. So, we don't think about these things. We use products every day that we use and throw away for procedures which are even less costly than implant and implant restorations, and they cost about the same amount of money. We've had a very positive response from many dentists. As I mentioned to you, we launched October 2021. We had kind of a ramp up period and a beta test period prior to that. And then since then, we've had a lot of different clinicians try it. And I'm really happy to say that we've had lots of organizations bring the product into their workflow. We have University of Pennsylvania using it, University of Washington. We have a couple other universities looking at it and testing it out. The Mayo Clinic is using it right now, and we have a number of VA centers and some military hospitals using it as well, along with a number of clinicians, many of whom you may recognize or you've talked to about it or heard about. So I think our community is learning about it and finding out about it. Again, with respect to recognition, we've received several design awards. And one of our favorite quotes here, design is intelligence made visible. And this was really important to us. And working with Andrew, we've received all of these medical and life science awards from these different organizations over this past year. So it's been recognized as a novel medical product with good design, good delivery, and good purpose. And in dentistry, we've received these recognitions here this past year. Celerant Best of Class Award for Technology, Gordon Christensen Clinicians Report Choice, first choice for screw channel barrier. They did a write-up last year, and it's in the top products in their buyer's guide. And just recently, we were recognized by Dental Products Report, their top innovative products for this past year. So with that, I'll just summarize. This was the reason we wanted to make this product. We wanted to have a compliant medical product for those reasons that I mentioned to you, the concerns that we had. We wanted it to have optimal properties for placement and removal. We wanted it to have a good feel. We wanted to improve the workflow for the clinician, so save time and create just a better workflow. And we wanted it to be cost effective so that everyone could justify using it, but also so that it was a safe and optimal product at a very cost-effective price. So with that, I'm going to just finish up on this slide. This is how you can get in touch or find out more information about the product, or if you want to call me and you have other questions, please feel free to call or email me. And I will end the presentation and thank you all for listening. And if there's questions specific to the product or specific about forming a company and bringing a product to market, I'd be happy to answer them.
Thank you, Jim. That was excellent. And I can attest, having used this product for the last year now, it's become our go-to product. We don't use plumber's tape anymore. And I think the most remarkable attribute of it is the handling, right? It's simple to condense. It's much more like a condensing a filling material in is plumber's tape. So, or glide floss we used a little bit for a while. So just much easier to handle, which makes for more efficient, especially when it's multiple units. However, we're using it for single units as well.
Todd, you mentioned floss. We discovered a lot this past year about what clinicians use, and we discovered that in the VA system, they're not allowed to use plumber's tape because it's an industrial product. So what some clinicians were using in the VA system, they were using floss as a screw channel barrier. So can you imagine how inefficient that is?
Right.
So yeah, interesting kind of information we've been discovering. Everybody who signed up for the seminar tonight can receive a small sample of this. So I don't know, somehow if you, Todd, you'll have everybody's information, or you can pass that on to me. We'll mail out a sample so everybody gets a chance to try it out on a few restorations. And if you have questions or you have other requests, please call me or email me directly.
Yeah. Yeah, and I think Kevin just mentioned he's going to be using the product. Most of my study club is going to be trying it out. So we'll give you some more feedback as more and more people are using it.
Thank you very much. Thank you, Kevin, for your comment.
Yeah, any other questions from anybody? Just put it in the chat box there, or you can come out of your mute and say hello. Well, we got Jim on the line here.
I know it's late for some of you on the East Coast, so I thank you for hanging in there and participating.
So I got a random question. Why'd you pick the color white?
Yeah, okay, it's a very good question. So this is again what you learn when you delve into developing a product and learning how it's manufactured. So PTFE resin and PTFE in general is pure white, and to color it you need to add pigments. So the industrial products add pigments of various sorts, and I mentioned to you that they add like nickel to make it gray. So none of those pigments are approved for use in say the human body because they're industrial pigments. So for us to create a colored product, it's not that we won't or that we don't want to. When this product is manufactured on a line and they're making on that same machinery, they're making say heart stents, or they're making sutures or any other medical products, if you color it, then it's contaminating the line. So then they have to have a dedicated machine or a dedicated line just to make that colored product. And then we also need an approved dye to be able to color it. So if there's enough demand for the product, this is just 1 year that we've launched that we've been available, that it's been available for clinicians. If it moves in the direction that we hope, and then there's enough demand, then you could run a separate line or a separate manufacturing for a different color. So that's the reason why.
And Jim, do you think that you think this type of product is, well, I mean, is it being used outside the US yet?
No, not yet. Todd, in Canada, we just received approval in Canada, so we're going to start to have some distribution there. We don't have distribution outside of Canada or the US. And so to sell in Europe, you have to go through their regulatory process, just like we have the FDA. So like we registered here with the FDA, we'd have to register with the European to get their CE mark and approval. So our goal this first year was to at least see if the product can be successful and of value to clinicians here in the US, or at least in North America.
Other question that came was, do you sterilize it prior to use? becomes sterile, correct?
No. So let me clarify. It's a good question. So when you manufacture a product and you're going to provide it sterile, that creates a whole other level of challenge with the FDA. So you have to provide all kinds of testing and analysis to prove that it's sterile. Because this is a medical grade product made from medical grade PTFE and all manufactured in clean room facilities, it's a very clean product. So as dentists, we all have autoclaves in our offices. So rather than increasing the cost of the product, because it would increase it tremendously if we sterilize it and went through that whole process of proving the sterility of it to the FDA, because it's a medical grade product and a clean product, you have two choices. You can use it the way it is. You can cut it into pieces. Like in my practice, we pre-cut it for efficiency. So I have, say, 2 centimeter and 4 centimeter pieces. And I just asked my assistant, give me a 2 centimeter, give me a 4 centimeter, because it's just efficient for me. You can soak it if you want to soak it in chlorhexidine prior to use, and then just wipe it off and then use it. I actually sterilize them in my practice. So we pre-cut them, as I said, in the 2s and the 4s, and we put them in little bags and my assistant sterilizes them. So I always have them chairside in sterile pouches. You don't have to sterilize it. It's a very clean product and doesn't have the impurities and the solvents that the plumber's tape has. So like Alex, for example, Alex likes to just put it in a dish with chlorhexidine, and he lets it soak there while he's getting his prosthetics ready, cleans his prosthetics, gets everything ready, tries them in, and then he basically, takes it out of his chlorhexidine, gives it a wipe, and then uses it. That's the way he likes to use it. I just personally like to put them in sterilization pouches and sterilize it.
Hey, Jim, Dave Meister, question on like multi-use. So I'm thinking provisional. I haven't got to play with it yet, but like compressibility and then going to retrieve it. Can you use it more than once?
Yeah. So it's what's really neat about the density and crystallinity of the way we designed this is that if you take it out and you pull it, you regain some of the shape and some of the compactability about it. So it's in the formulation of it. It's designed that way intentionally. So if you sterilize it, it shrinks a little bit. So what you can do is you can pull it a little bit to increase kind of the so-called air pockets in it to allow that same feel and compactability. So let's say you're doing a provisional and you want to reuse it as long as it's clean, or you can drop it in chlorhexidine for a little bit and do your clinical steps for the whatever you're doing, and then before you close it, just rinse it off and then pop it back in. For a final, I would recommend that you use a brand new piece, clean piece. But yes, that's how you would do that. Yeah, just give it a stretch. Yeah,
got it.
Excellent. So we're coming up on an hour here. So any final questions here for Jim?
This was great. Thank you, Jim.
Yeah, thanks so much, Jim. Really appreciate it.
Everybody for listening. I know it's late night and not a super exciting topic. I know this. I usually like to talk about surgery myself. It's more exciting for me, but I hope that the story behind it and how we kind of understand the development of a product and then what it goes into manufacturing and then what's expected of us as clinicians, both from the medical legal standpoint, but also from our patients. I hope that was interesting for you.
Yeah, absolutely. Appreciate it, Jim, very much, and thanks everybody for coming on tonight. And we'll have another webinar in 2 months with another exciting topic. We'll keep your eyes peeled out on the iHDS website for more information coming to you.
Thank you very much.
Thanks, guys. Have a good night, everybody.
Thank you, everybody. Good night.
Bye.